Hi, my name's Caitlin, and we are going to talk about girls' high school water polo and how beneficial it is. So why do you want your kid to play high school water polo? It's a fun, engaging, and challenging team sport. It's a four quarters game where two teams are playing against each other and attempt to score goals by throwing the ball into their opponent's net. Like any other sport, the team with the most points at the end wins the game, and there are six field players and one goalie in the water at any given point in time. It's challenging and competitive, but ultimately it's fun to play and helps the individual build character, and then they become a better individual team player. Um, with any sport, there are risks for injuries, especially in water polo. There is a risk for medial collateral ligament injuries, which is the ligament on the medial side of the knee that connects the femur to the tibia. Medial collateral ligament injury can be either a sprain or a tear that results from either twisting or direct impact, and they can be categorized into three different degrees, such as the first degree sprain, which is damage only to a few ligament fibers, a second degree sprain, which is damage to a more extensive number of fibers, but the ligament still remains intact, or a third degree sprain is a complete rupture of the ligament because of the force involved in this injury and other structures of the knee, such as the meniscus or the anterior cruciate ligament, which could also be damaged. How this happens is through the egg beater kick. Your knees are constantly going in different rotation manners from left to right, which is causing strain on the MCL. Here's the link for the YouTube video so you can see how the egg beater in action. The mechanism of injury is due to blunt force trauma to the knee. It's the opponent kicking off from the individual or the constant twisting of the knee during the egg beater kick. So here's just the image of the MCL injury so you can see the grade 1, the grade 2, and the grade 3 tear versus the healthy MCL. So this is just so you can see the egg beater kick in action, so you can see that the knees are externally abducting and rotating, which is causing more strain on the MCL. So again, the injury is to the knee joint, specifically at the MCL, and the ligament is located on the medial side of the knee. Tests that are used to diagnose and assess are usually determined by the doctor, and it can be done through an MRI to determine it. Also, the doctor can be bending your knee and place pressure on the outside of it, which will indicate if your inner knee is loose, which would indicate if there's MCL injury. To treat it, it's usually with physical therapy and patellar taping, as well as surgical treatment with the repair of the MCL. There's the three rehab and prehab exercises, which is a passive knee extension. You're going to do 3 sets of one, 3 times a day, 7 days a week, and then to progress, you would do 3 sets of 2, 3 times a day for 7 days a week. Also, the sideline leg lift, there's 2 sets of 15, 7 days a week, and to progress this, you would increase to 3 sets of 15, 7 days a week, as well as the wall squat, 2 sets of 10, 6 days a week. To progress, you do 3 sets of 10, 6 days a week. Another possible injury is the rotator cuff tear, which is one or more of the rotator tendons being torn and no longer attaches fully to the head of the humerus. Most tears usually occur at the supraspinatus muscle and tendon, but other parts of the rotator cuff may also be involved. Torn tendons begin by fraying, and as the damage progresses, the tendons can completely tear. Like I said about the knee prehab and rehab exercises, we are going to make sure that we strengthen those knee muscles to help prevent the injury from occurring. The same goes along with the rotator cuff injury. We do our best to make sure our athletes are trained so that they are not overusing those muscles to prevent the injury from occurring. Rotator cuff tears in water polo occur due to the repetitive motion at the shoulder joint. So we're going to make sure that we switch out players and make sure that everybody gets equal time versus having one player in most of the game and then increasing the risk for injury. So here's an image of the mechanism of injury. So you can see the shoulder abducting and extending and flexing. So it's just a constant rotation. So it's going in all different directions. And here's again, you can see the anatomy, what's happening. You have your biceps tendon. You can see your infraspinatus muscle, your supraspinatus, the subscapularis muscle, and those are all what make up the rotator cuff. So it's made up of the humerus, the scapula, and the clavicle, and it's a ball and socket joint. So it's made up of the supraspinatus, infraspinatus, teres minor, and subscapularis muscle. And then there's also a bursa in between, which is a lubricating sac. So that lies between the rotator cuff and the acromion process, which allow your rotator cuff tendons to glide freely when your arms move. To assess for the rotator cuff, the doctor will check to see if there's any tenderness or area of deformity in the shoulder. And we'll also measure the range of motion in your shoulder by having you move your arm in several different directions, as well as test your arm strength. MRIs are a useful study for detecting this, and then the treatment is the exercise rehabilitation without surgery, or they may have to do arthroscopic surgical repair. Like I said earlier, the key things to prevent this is overuse, so you want to make sure that the players are rotating in and out, so it's not one player having the bulk of the responsibility of playing during the meet. Some good exercises for this, for treatment and repair, are the doorway stretches. You're going to do 3 sets of 2, 7 days a week, and then there's the instructions of how to progress this, and then sideline external rotation with light dumbbell. 3 sets of 10, 7 days a week, and then progress that, and then lawnmower pulls. These will all help strengthen the muscles in the rotator cuff, because we want to make sure those are giving a stable shoulder joint to the individuals to prevent further injury. Also, another risk is a muscle strains in the lower back due to repetitive twisting at the trunk in the water polo. The extensor muscles, the flexor muscles, and the oblique muscles all are what compose and help strengthen the lower back. The mechanism of injury is rotation at the trunk, and you can see it, you're going to wind back your ball, and so when you do that, you rotate at your trunk in order to shoot your ball. This occurs due to the constant rotation of the spine when winding up and shooting the ball, and the arching of the lower back with the hyperextending of the spine. Here's a YouTube link to see this in action. It can occur anywhere along the lumbar spine, but it can take place in the erector spinae muscles, the internal or external oblique muscles, or the serratus posterior inferior. This is due to diagnosis through the recording of medical history of the individual, using x-rays to rule out any fractures, and an MRI can also be used to make sure that there's no problem with the disc, any bulging or herniation. To treat this is usually through physical therapy and massage of the lower back. Some exercises for rehab and also to prevent it is a pelvic tilt. So this is going to strengthen your abdominal muscles as well as your lower back, so that if you have tight abdominal muscles, it's going to help you better support your spine. Heel slides. And doing this will again also help strengthen your hip flexors as well as your abdominal muscles and parts of your lower back, because all of this combined helps you to have a more stable spine. And then the prone cobra, doing 1 set of 10 and holding for 3 seconds, 7 days a week. This is also going to strengthen those back muscles to help you build a strong back. So even though there are risks with water polo like any sport, as a coach, we just make sure that we are being conscious of those injuries and rotating the athletes in and out so that they're not just the constant one with the bulk of the work, and doing preventative exercises to strengthen those muscles to prevent future injury.